Folks, we will start in 2 to 3 minutes. Please make sure your cameras are on. Your speaker has also joined. Hi, Mi. Can you hear us and see us?
Hi, everyone.
Hi. Can we wait for
Mhm.
a minute or two so that few more folks can join, if that's fine with you?
Sure.
Perfect. Lovely. We'll wait for 2 minutes and then we'll start. Thank you.
I'll share my
Yes, we'll
presentation
give
in the
you
meantime.
rights so that you can start sharing the screen.
Can you all see my screen?
Yes, it's visible.
Right. Thank you.
All right, me. I believe we can start in the interest of time, and the rest of the folks can join in the meantime. Everyone, it's a great opportunity for me to welcome me to all of you on behalf of the Office of Career Services. Me has been serving as a senior associate in the talent division of Clinton Health Access Initiative and has more than a decade of experience in leading HR functions across multiple and major social impact organizations in the South Asia Pacific. Apart from that, we have been told she's a strong working mother as well, taking care with her child and the organization. Can we all give a warm round of applause for taking her time for all of you at Global Governance Initiative? Welcome me to GGI and our team. Niharika will be here throughout the next 60 to 70 minutes, making sure that you have a smooth conversation with our fellows and scholars. And the floor is completely over. The floor is yours, completely over to you. Welcome.
Thank you very much, Shatakshi, for that very warm welcome. I appreciate it. So yeah, like she said, thanks to you all for having me here today. She did an amazing introduction of myself, but just so you know, I have been with the organization. You can call us GGI. That is our short name. So I've been with GGI for more than 7 years. This September will mark my 8th year in the organization, and I am from Vietnam, and this is also where I am based. So yeah, that is why I had a chance to connect with GGI, because there is a former GI staff member who is currently with the organization, and she introduced me to you all. So happy to be here today to share with you about what GI does and how you can join us. But I think before I can start, can I ask if any of you on this session today know about GI before you come to the session?
Folks, you can raise your Zoom virtual hands. Niharika, you
Can
can
raise
play
your hand.
God and unmute people as and when you like. Niharika, you will be able to unmute people? Perfect, lovely. Folks, you can raise your Zoom virtual hands.
Yeah, we have one. Well, great to see. Well, I mean, regardless of whether or not you know about GI or not, I'm happy to share with you more about what we do on this quick session today. I will try to make things easy to understand, because I think GI can be a little bit complex. And following up after this session, you can feel free to get in touch with me if you have further question. Unfortunately, I'm not able to get a colleague from a program team on the call, so I'll try my best to explain to you from my experience of more than 7 years in the organization. So let me just start by walking you through the agenda for today. So I will first speak about GGI's mission and how we were established. And then I will speak through the programs that GGI is working on at the moment and what our approach and model is. And then lastly, I'll speak about where we are at the moment and how you can join the organization, what our recruitment process looks like. So with that, let's just get started. So speaking about how we were established, it was back in 2002. We were established by the former US President Bill Clinton. You may have known of his name. Together with Ira Magaziner, who was working with him in the office before he left, they founded the Clinton HIV/AIDS Initiative because at the time, HIV/AIDS was a disease that is very fatal, and the treatment was available already, but not in low and middle income countries, but in wealthier country. And so they initiated this program to make the treatment more available in this country. And over the years, we have expanded our work beyond HIV/AIDS. And so in 2010, we become the Clinton Health Access Initiative, which is our name today, in short, GGI, to better cover our broader portfolio. But even though we have gone through the expansion, restructuring, our fundamental belief is still the same. So we believe that everyone, regardless of where they were from, like where they were born, they should have access to healthcare, and not just basic healthcare, but the best healthcare possible. And so with that, our mission is eventually save lives and reduce the burden of the different diseases in low and middle income countries around the world. And to do that, we have been working in partnership with different governments across continents, Africa, Asia, where I am, Mesoamerica. And we partner with the different governments, our donor governments, and the other NGOs, as well as the private sector, in order to create a sustainability, strengthening the government and private health systems in the countries where we work. And this is the values that we live by at GGI. I will not go into every details, but I will highlight a few so you understand the work culture at GGI and what we look for from the candidates as well when we do our recruitment. I think I will highlight first one thing, which is that we work in cooperation with and at the service of the partner government. Why? Because we believe that to make the program sustainable and scalable, we need to help the government by aligning our strategies with their strategy. We work at their priorities and their goals. And by partnering with them that way, we are able to create more transformational impact and create a sustainability, and we can eventually walk out of the programs after we are not there anymore. They will be still able to continue the work that we started. And I also want to highlight that we are very frugal. Well, maybe let's speak about mission driven first, which is very important for sure. Because as a non-profit, of course, we want you to come to GGI with a belief in the mission that we carry. I can tell that over my more than 7 years in the organization, I have been inspired by so many colleagues that I have supported, and people who came to GGI as a new hires as well, because they are all very passionate and very dedicated, and they believe in the healthcare programs that GGI is working on. And the third thing I will highlight is about frugality. So basically, we try to make sure that all of the grants that we were able to fundraise, they go straight more into the program activities themselves, rather than compensate ourselves with unnecessary things like a lavish office or traveling with business class. That is not something that you will see here at Chai. We also operate based on trust and transparency. I would highlight this because we trust in our staff to do a good work, because you will see yourself sitting in the Ministry of Health office. You work with very high level stakeholders, the ministers, um, like the C-suite from the private sector stakeholders that we are collaborating with. So we trust in your ability to be able to deliver, and we trust in our partners as well. So we need to have that level of transparency as we perform our work at GI. And lastly, we recognize that staff at GIS is our greatest asset, because we are an NGO and we do not produce any products or services here. So yeah, that's about how we were established. Now I will speak about our programs and GIS model. I will say that over the years, we have undergone quite significant reorganization, and today we organize ourselves in these clusters. As you can see, we started with HIV/AIDS, right? So the first cluster is infectious diseases. So today we still work on HIV, and beyond that is TB, malaria, hepatitis. And then the other cluster is women's and children's health. So we have maternal, newborn, reproductive health, nutrition, vaccination, and then universal health coverage. We work on health financing, health workforce planning. And as we speak today, JAI also have a dedicated digital health team as well, which is a part of this cluster. And then most recently, we started working on non-communicable diseases like cancer, particularly cervical cancer, diabetes. And if you look at JAI's website, I think the latest program that we started working on is climate change. So you will start seeing more of that coming. And then besides that, we have groups of cross-cutting experts. Like the market shaping teams, including global markets and lab services team. So particularly these teams, what they do is to work on the supply and the demand sides of the market. So they can help shape the market and then realize the savings for drugs, for devices, for the different health commodities that are coming into the market. And we make sure that these products are available across countries. And then more technically, we also have the global health sciences team. As you can see, the clinical sciences, analytics, and research team. And then lastly, assistive technology. So these are a lot of different programs, but what is our approach and our model when we work on these programs? We consider ourselves, first of all, a market shaper. These are where we see our values coming in. We create a sustainable marketplace for these health commodity to enter the market with a more equitable access. And we also consider ourselves a trusted strategic partner, meaning that we will work with all of our partners to plan for the strategies. But we do not only work on strategy. We also consider ourselves an operational partner because we also work on implementing these strategies. And so with on these three values, we hope we can be an ecosystem catalyst, because we imagine what is possible. And with that, we can create a more transformational impact. So that is our approach. Now, I will speak briefly about how GI is structured. I think this is also important because I think our structure is not the most typical. I think most people, they are more familiar with the structure of, headquarter and then regional offices and then country offices, but GI, we do not follow that structure. You will see that we only have country teams and global teams collaborating with each other. So, for example, if you are a regional manager on a global malaria team, you are basically at the same level within the career ladder as a program manager on a malaria team in, let's say, Vietnam, for example. But what is your scope of work if you're on each side of these teams? So if you are part of a country team, it means that you will have a more comprehensive understanding of the country's preferences, the local nuances. You will focus on building the partnerships with all of these ministries, these high-level stakeholders in the country, and you maintain this relationship. And you will also analyze and you report on the product uptake data, for example. You provide a real-world feedback on the global initiatives that GI is driving. And if you're a part of a global team, you will monitor the global trends, you gather the market intelligence across countries, you will have a stronger understanding of the supplier information, and you manage the relationship or you participate in global meetings across countries. And you will likely have a better understanding of the product pipelines of the new products coming into the market. And a strong working relationship between global teams and country teams at Chai, it basically underpins everything that Chai does because it allows us to effectively support and drive the change at the national level while sharing the lesson learned and the critical information across the different regions that Chai is working in. With that, I can give you an example. I will take an example from the malaria and NTD means neglected tropical diseases. So this program is organized around our broader global malaria strategy. So I will speak about what I will work on in this program, and then I will explain to you how country teams and global team works together. But first of all, speaking about the program's goals, depending on the region, the countries that we are supporting, they may have different priorities, and so they will be at different stages. So, for example, in African countries, our goal is more to reduce the mortality, whereas in other regions, for example, the Greater Mekong sub-region in Asia, we are heading towards elimination. So different regions, different countries will have different focus. And what we actually do can be a lot. For example, we try to increase the effective coverage of the case management, or we improve the deployment of the prevention tool, or we try to strengthen the information system to monitor all of these activities, the number of cases. We improve the routine analysis and how we use these tools. And we maybe facilitate strategic planning. So there are just a lot of different things that we can do for different programs. And again, depending on the priority of the country, you may not work on all of these things, but you may focus on one thing. But at the global malaria team, we will have different sub-teams that will focus on these areas. So, for example, for this first program cluster, we have a team dedicated to case management. For that second one, this is about vaccine control, vector control and prevention. And then we have digital health team, we have malaria analytics, surveillance and technology, and then we have malaria strategy and financing team. Like I said, country team, depending on their focus, they will focus more on the different things that you see here. And like I mentioned earlier, in the Greater Mekong sub-region, we have been supporting these countries since 2008. So starting with Cambodia, Laos, Myanmar, and Vietnam. And from all of the lessons learned, since 2021, we started working with the government in PNG and India to start fighting against malaria disease. So I hope that gives you a good example of the work that GGI does and our approach. Now I will speak briefly about who we are and how our recruitment process looks like. So this is where Chai is today. As you can see, mostly in Asia, in Africa, and in some country in Mesoamerica. And we have a small number of staff members who are based in the US and some European countries because we do have stakeholders in these countries, and it's easier for them to be there to collaborate with them. But most of our staff are in those countries, as you can see on the map. In I think 40 countries now, if I'm not mistaken. And there's a few highlights here. We have more than 50% of our members as local national because this is very important for the work that we do, that we understand the local nuances, their preferences, like I shared earlier. So most of our staff members, they are local national where they work. We put a very high priority on diversity. So I would like to highlight that half of our staff members at the manager level identify themselves as female. So we try to keep the balance as we do our recruitment. I would highlight that India is one of the three largest office that Chai has. And this is the career ladder at Chai. I think it's pretty typical, and you may be familiar with this. I think we are quite similar to a management consulting firm. So people can start at Chai at the intra level with titles like analyst or program officer, coordinator. They can have, I would say, less likely zero, because usually Chinese you to have some sort of experience already to be able to hit the ground running and work with very senior high level stakeholders. So I would say zero means you may be a fresh graduate, but you already have some internship experience, for example, volunteer, whatever. And then at associate level, you are more experienced. You are able to independently lead some project on your own with limited guidance. So you will be in roles like associate, senior associate, senior program officer. And then from there, people tend to go into two different tracks. One is a more program management track. So you will focus more on managing programs, coordinating teams, and the other track is an expert track. So you may want to develop more your technical expertise. So we have titles like program manager, technical advisor, accordingly. And then above that would be senior management. You can expect to be a senior manager or director level. I will highlight a few things here that, excuse me, Chai is very flexible because our teams, it comes in different sizes. So you will see there are teams who are more rigid with the job titles, whereas smaller team, they may be flexible. And so there is nothing set in stone in terms of the timeline for growth, because you may have already reached the ceiling in your team. And you may not have a promotion in like a year or two, but you can always expand your shirt in the different teams across Jai because we enable that kind of transition. I have supported a lot of colleagues moving from one program to another within the same country team, or they move from a global team to a country team, move countries. So there's a lot of flexibility that we encourage our staff to pursue within Jai. But just noting that there's nothing set in stone. We do not have a time frame like, okay, in like 1 year or two, you can expect to become a senior associate or something like that. So when you do your job search, I would advise to be more flexible, because there have been people who had already been in a manager level in their previous experience, but they joined Jai as a senior associate, for example. So just look at the transferable skill set that you have, and maybe the programs that you're interested in. You can filter for these kind of things, and then apply for as many roles as you want. And then in terms of the recruitment process, so we have a career portal, and we would ask you to submit your application on that portal. I put a link here. All of our open positions are posted there. So if you see a role still posted, it means that they're still open. And usually if the recruitment is supported by my team, because sometimes country teams, they will work on the recruitment themselves if they do have the capacity, then the recruiter will review all of these applications and then work with the hiring team to shortlist them. And because of the considerate number of applications that we are lucky enough to receive, we will only reach out to people who are shortlisted for interviews. You will likely do a technical assessment. There are some roles we don't ask you to do so, but they will assess your technical skill only through two verbal interviews. And depends on the level of the position, you can expect to go through 2 to 5 rounds of interviews. I think 5 is more for like, first of all, global team positions and high level position where you have to coordinate with a lot of different stakeholders. And then proceed to an offer. So that is a typical recruitment process. And in terms of timeline, it can go from anywhere from I would say 1 to 3 months, because sometimes hiring teams, they have very high level priorities for their program activities. So sometimes they have to put a pause on the recruitment and then they resume when they have more capacity. So that is the reality. So just a heads up that recruitment can take a long time here at Jai, even though when we are in an urgent hire, because they are so stuck with their capacity, they will try their best to move as fast as they want. And a lot of interviews are done virtually, especially if you are interviewing for a role being based somewhere else, or a global team position where your manager, your internal stakeholders, they are not based in the country where you are based. And because I'm talking about like international hire, I would like to highlight a little bit of our benefits package for people who are requested to relocate for Chai, because I think it is important to offer that. First of all, we will support you with your relocation. So the package will include the flight ticket, and in your first paycheck, you will receive a lump sum amount of 4,000 USD. If you relocate with your family members, we will cover up to 3 of them. And each of your family members will be eligible for 1,000 US dollars. And then interim housing as well, from 2 weeks up to a full month, depending on how long it takes you to find a place on your own. And then international health coverage. Currently, we are using Cigna International, in case you know them. And then other insurance like life insurance, AD&D, disability insurance, and then a retirement plan. It is, of course, an international plan, not tied to the local plan in your country of assignment. And then annual home leave, which is a one round trip flight ticket for you to return to your home base. I assume India for you all here. So we reimburse one trip a year, but of course you can make as many trips as you can using your leave days. And then I also want to highlight the International Employee Assistance Program. Actually, this one is available to on-site staff member, not just international staff, but I think it is important to highlight for international staff because it is a very useful resources that you can use. They will provide you with guidance and resources for different variety of personal needs. Like, for example, I have a colleague based in Rwanda, and they have some issue with the landlord. So they reach out to the program, and the program give them suggestions like who to reach out to, what kind of legal consideration they should have. Or if you have mental health issues, you can reach out to this program as well, and they will provide you with consultancy sessions, I think at no cost. So yeah, these are a few highlights of the benefit package that I think is worthwhile to note here. And with that, I have reached the end of my presentation. So I hope it has been informative, and feel free to let me know if you have any questions. Now I give you back the floor.
Thank you, May, and it was very insightful, and I think most of the questions were answered, but still, our cohort is very eager to know more about Chai and the working prospects. So, the floor is open to all of you. A small request, if you can open your switch on your cameras and to ask your questions, please, you can raise your virtual hands.
Maybe just a heads up, Niharika, Since I'm not a program person, right? I'm not a technical person, so any technical question, I'm afraid I won't be able to answer. But you can try me. If I'm not able to answer, I'm happy to take note the question. Maybe Niharika, you can help me with that, and then I can get back to you after the session and provide you with the answer, and you can share across the group here.
That would be helpful me. Yeah.
Hello, ma'am. Thank you for the lovely presentation. I had just a question. As you mentioned, you have from 0 to 2 years experience also for entry level positions. So will that also include fresh college graduates, which who have 2 or 3 internship experiences?
Yes, you're correct. If you have experience as a volunteer, internships, or even I know that sometimes people they have like assignments that they have to do like a full project in an organization, and that could work too. But I would say that competition is quite intensive here. So usually I would say that most people they join Chai with some level of experience already. But I mean that's just the reality, right? But I would not discourage people who don't have like any full-time professional experience to apply because like I said again, this volunteer experience, your project can still count.
Ma'am, and I'm specifically asking for the technical roles. You say you also have for data analytics and all those roles. Is 1 year experience, minimum 1 year experience required for those roles also?
Yeah, usually I would say so.
Oh, thank
Yeah,
you.
these I would say teams they are very specific with their requirements. Usually that would be the first 1 or 2 lines that you will see on the job requirements. So it should be straightforward.
Oh, thank you.
Thank you for the question.
Hi, I'm not sure whether I'm pronouncing your name correctly or not, and Nugyung. So I was really excited with the Clinton Cell initiative they have done so far. I have a couple of my folks working there, but I have a bit of confusion in terms of understanding how things work. So I saw a post recently regarding a sexual health and maternity division and immunization divisions. So which department is this hiring for?
I'm sorry, Rishi, you were cutting a little bit. I heard that you saw a job advertisement and you were not sure which division it was for, right?
Yes.
Would you mind repeating again the division that you saw on the job post?
So it was for sexual and mental maternity health and 1 award for immortalization in India, New Delhi.
In India. I think you can share that job post in the if we do have a chat box here, I can help you check after the call because we do have an HR recruitment team in India. And my team, we don't usually support recruitment in India, so I don't have the full visibility. So yeah, I can help you check after this. Right now, I'm afraid I do not have the answer for you right on the call.
Makes sense. And just a follow up. So which department is this hiring for within
You mean
Chai?
for that job post or?
Yes, for the current like session, info session.
Oh, it is for Chai globally, there, Rishi. I shared with the facilitator for the session today that after this session, I will put them in touch with our team in India, particularly. And you guys may be in touch with that team in the future. But this session, I wanted to give you all a global overview of Chai and how our process typically looks like. I think it is pretty straightforward and similar in India as well. Because I used to work with them in the past, but now they have a dedicated team, so we don't really work together anymore. But from time to time, I share my candidates with them, and they did the same. So yeah, it should be still relevant, and the approach is the same. The program cluster is still the same. So yeah, that's that. I hope I answered to your question, Leo Rishi.
Hi, me, Nguyen. I hope I'm pronouncing your name right. But thank you so much for the session. I have worked in red light areas on HIV a lot, and now I'm working with an impact consulting firm in India. I've been working with non-profit organizations and designing strategies for them to engage more effectively with the government, and that's how I got to know about Chai and got more interested in the work that you do. I have gone through different roles that are open within the global teams and also some of the country teams. And one particular role was around HIV in the global team. And I just wanted to understand how do global teams work with the government, number one. And second, do you look for certain qualifications specifically for global teams compared to the country teams?
Right, great. Thanks, Priya. It's great to hear that you knew about Chive through your work. I think if we are in the development sector, at some point we will know about each other. So to your question, first of all, how global team works with local governments, right? I think it depends on the programs you are in, the team you are in, because it varies. I have worked with colleagues who were very much involved in these meetings with the local government, with our country staff members. But there are also colleagues on global teams who I know focus more on coordinating with the different country teams across countries that JAI is supporting without direct interaction with the local government partners. So it depends. It varies from teams to teams. And usually during the interview process, the hiring team, they will share more insight into the day-to-day and the expectation that you can have when you join that particular team. And then to your second question about the qualifications, I would say that again, every recruitment is different, but regardless of global teams or country teams, I would advise that there are three particular skill sets that I always look for. The first thing is your analytical skills, because in public health we deal with like a great deal of data, big data. So more or less, you will find yourself working on data analysis. So that's the first thing that I would say you need to have. And the second thing is your ability to manage high-level relationships. Like I mentioned during the session, you will find yourself working with very high-level stakeholders. So if you're on a country team, like I mentioned, you will work with ministers. You will work with all like different minister and different local authorities. So we need you to be able to lead this conversation on your own, regardless of your level of experience, right? And then if you are part of global team, the tendency is that you will find yourself working with other stakeholders like the private sector, for example. You may work with their senior management team on product roadmap, logistics, planning, etc. And then the donors as well. We have donor government, so you may still work with the government partner, but not necessarily our beneficiary. So yeah, that's the second thing. And then the last thing I would highlight is about project management, because you will more often than not juggling different work streams on your plate. So we need you to be independent in leading these projects on your own with minimal oversight. So these are the three things that I would say, regardless of teams you're in, global team, country teams, you will need that to be successful. And like I said, again, each recruitment will be different. So maybe this team, they will need you to have more of an analytical ability, because in the team, they are missing that kind of expertise. Whereas you are joining a country team, and they will be expecting you to be able to better manage the relationship with the local stakeholders, right? So it varies, but yeah, these are the three main things that I would say Jai will always look for. I hope it helps.
Yes, definitely. Thank you so much for clarifying. Yeah.
My pleasure.
Hi, madam. Thank you so much for the session. It was a very insightful session. My question is less on the hiring side and more on the government and chai interaction side. So Priya already, asked that question, but mine is a little more emphasized on how, since India just came on board in the year 2022, according to in chai, and it is in a very early relationship building phase. So how does chai balance being frugal and entrepreneurial, because you emphasized a lot on the frugality aspect as well, and how entrepreneurial chai is, and how it is like interacting with the government systems, not just for India, because there are a lot of other countries that chai is working on in the Southeast Asian region and different countries. And there's a lot of digital health and AI diagnostics also coming up today. So which is like a lot of clashing, because we have to interact with high level government, we have to interact with low level government, we have to interact with private sectors, and we have a AI diagnostics, which is like the need of the hour. We really need to put that up front. So like, how is it making the government partnership? Is it hardening, or is it like actually opening up the doors? Like, it's just something that came into my mind, so I had to ask you.
Thanks for that question. I would say it is a big question, then I can respond to you, to be honest. But I can try to share what I know of, at least. First of all, you were talking about frugality versus entrepreneurship. I think this is where Chai comes in, because I think from my point of view and from my experience here at Chai, I think that should not be a clash, because being frugal with an entrepreneurship, I think it means that Chai tries our best to use whatever resources that we have in the organization. And in working with our partner government, we try to help them see the potential from their workforce, for example, how they can better utilize whatever finances they have. So frugality is not just from Chi's end, but this is also how we interact with our government partners, right? So we help them use their finances, how they can allocate their resources, how they can build capacity for their health worker, so they can reduce the time, and in that way they can reduce the money spent. So that is one example. And you also spoke about like new technology coming in. I think one example from Chai is that we are actually using AI ourselves. We recently implemented Cloud AI, and we have that like we are using like a pet version, if that's how I should put it. And in order to do that, of course, we have to make a case. And everything that we do, it is from the funding that we receive, right? So we have to look into the potential, whether it makes sense, internally, whether it helps us, and then externally, whether we can utilize that when we implement these different activities that we are collaborating with the external partner. And so we are able to make a case and then raise funding for these kind of initiative. And of course, again, frugality is at the top of our mind. So of course, we try our best to look for the different options that we can have, and then choose the one that can make the maximum impact with the lowest cost. But of course, sometimes we have to go for like the higher priced one. But it has to be a balance that we have to keep when we look at the different options. So I would say that is as far as I can share with you for now with that big question, Nagalashmi. I think a program team, they will be able to respond better to that, because recently we also formed a team. This is a global team, and we call them innovations team. So this team, they focus on looking at the different new technologies that are coming in the market. And like I said, they analyze these different options and the prices, the cost, and the impact that we can make using these technologies. So yeah, we have that team that is recently formed. If you look at our career portal, I think you will still be able to see a few job posts for that team. So that's just one example. Yeah, I hope I was able to partly answer to your question, and thanks for that great question that you had. Thank you.
Yeah, just unmuted. Thank you so much for the very detailed answer. It was very insightful, ma'am. Thank you so much.
Pleasure.
Hi, thank you so much for the wonderful details about the offline.
I'm sorry, Nikita. I don't know if it's just me, but you are breaking a lot. I cannot really hear you.
The experience. Okay. I think low bandwidth, so I'll just turn off my video if that's okay.
Yeah, it seems a little bit better.
Is this better?
Yeah, it seems better.
Yeah, so I'll just keep my video off. Yeah. So I was just following up on one of the skill question that you answered, that child looks generally for the three kind of skills: the analytical skills, the project management, and the relationship maintenance with the different stakeholders. Just in addition to that, I wanted to understand, when you say the experience, somebody who's probably doing this but may not be doing particularly with the health sector stakeholders, or probably a health data set. Uh, so do you count do you want like a relevant experience on the thematic, or do you want the experience to be more on the three skill set that you mentioned when you look at 6 to 8 years of experience for the program manager position?
Yeah, thanks for the question, Nikita. So just to make sure I understood you correctly, because you were still breaking. So you were asking about the skill set that I mentioned, and whether or not we are looking for like specific industry experience or broader experience that the candidates have, right?
Yes.
So to answer to that, again, it will depend. There are roles where we need the person to have the experience within the health sector, sometimes particularly public health sector, because maybe you are filling in a gap that we have for an urgent need, and we need you to already have a familiarity with the sector and the key stakeholders in the sector. But I would say most of the time, because I'm speaking from my recruitment experience at GI, right? I would say most of the time we look at more transferable skill sets rather than industry particular experience. For example, I work with the global markets team, for example, and they hire for an associate to join their team to work on market shaping initiative. They will work with a lot of different suppliers. They will deal with sometimes donors requests as well. And we do not look for people who have experience in the health sector. A lot of them, they may come from a different industry. They may be management consultants. Maybe some of you here are management consultants, and you don't necessarily have experience in the health sector, but we will look at how your strategic thinking is, how you are able to manipulate data, how do you do your market research, and how you can like make the recommendations from these findings, and your methodology, your approach to problem solving, how you will manage a lot of different dynamics from the different stakeholders that you are going to collaborate with. So we will look at these skills, these competency, rather than whether or not you come from I don't know, another NGO in the public health sector, or from a big pharmaceutical company. So yeah, it again, it depends, but I would say most of the time we don't really require industry specific experience. I hope that helps. Thank you for your question.
Hi, Me. Firstly, thank you so much for taking out the time to speak with us. It's been a very insightful session. So I am a student, which means that I'll be applying for jobs probably a year or two from now. But in the meantime, I would definitely like to contribute to the space and particularly your organization. So I was wondering, are there any internships that we can apply to in terms of opportunities that might be available? And if you could just shed some light on that.
Sure. Yeah, thanks for the question. We do have an internship intake once every year. For the past 2 years, that has been the case. I don't know, maybe we will increase the frequency. But every year we open the application for internships. I think this year it was I think it started from November of last year or December, and then we started to screen the resume and then propose a different a strong profile to the different teams at GI. So I think you can keep an eye on our career portal for that. Maybe because of the increased numbers of needs that we had from the different teams' requests, we may increase the frequency. But otherwise, what else you can try to look for is a different short-term engagement that from time to time teams that will have. Because, for example, I would say one example is the global malaria team. Every year, somewhere around March, they will have a search in preparing for funding proposal to send to apply for the global fund. It is a yearly activity, and for sure the team they will have that kind of needs, and not just global malaria. I think other programs they may have those kind of needs that they want to get some extra help from outside and not a full-time employee. So all of these kind of projects needs we will post on our career center as well. So you can look for first of all that internship intake, the annual one, and then the short-term engagement. You can search for short-term opportunities on the career portal and see if there's anything available. And sometimes teams they will post for independent contractor as well. It can be just for a particular work stream on, I don't know, analytical work or some research that they need help with. And I think research work, for example, will be very much relevant to the different students who are looking for internships. So I think these are the three different opportunities that you can target. I hope that helps. And Niharika, I really need to leave
Thank you so much.
because we are running over time. I'm sorry because I have a hard cut actually. But I will be happy to answer to any other questions that you all may have. Feel free to reach out to your facilitator, Niharika, and I'll be happy to answer over email. Okay.
Sure, me. Thank you so much for your time. We do understand that. And just for the last, before wrapping this session, we have this tradition of making a G after every session and after every masterclass. So I would request everyone, if they are able to switch on their cameras and make a G. I'll take the screenshot of Isha, Yashika, Vidushi. All right, all right. Thank you so much, guys. On the count of three, everyone, a small smile and a big smile and a G. One, two, three. Thank you. Thank you. Thank you so much, everyone. And thank you, me. Have a good night and a week ahead.
Thank you, everyone. Bye for now.